But these are just things you have to consider when you are coming off a prolonged fast, is that your digestive system hasn't been activated for however many days that you're planning on fasting. So sometimes it's good to take some supplement. We call it supplements for a reason. It's supplementing for something that we're not getting in our diet. But when we have been this long without consuming, we do need a little help for a little bit, for at least a good month or so, depending on how long you've done your fast, to be able to get things back on track with your digestive system. Hey, what's up, fasters? Dr. LeGrand here for another video. If you are new here and are interested in fasting videos, health tips, other alternative practices, and treatments, this is the channel to be. So hit that subscribe button, and so that you don't miss out on any other kind of future videos. So today I'm going to talk about what you need to do when you're doing a prolonged fast, when you're coming off a prolonged fast, especially when you are having severe digestive complaints coming off of a prolonged fast. So I thought for today's video, I'm going to actually talk about a experience I had with a patient. This patient particularly came off a 40-day fast. And with this, they came in to see me because there's not too many doctors out there that actually specialize in fasting or focus on fasting. And so they were able to kind of find me and then sought me out to be able to help with his digestive complaints. And with this patient, after he came off a 40-day fast, he did break it properly. And while breaking it properly, he was doing liquids really well, doing bone broths, keeping it very light for a week or so, and then he started implementing, things such as vegetables, healthy fats, very slowly. But yet he was having very digestive complaints. He was having abdominal pain. He was having acid reflux issues. He was also having constipation issues, diarrhea. It was just all over the place, and it was very discomforting to him. And he was at a loss. He didn't know what he could do, so he kind of sought me. And after kind of analyzing it, doing some physical exam, he was having a lot of distension, which is basically a lot of gas and bloating going on. He also, on physical exam, very tender to deep palpation around the abdominal area. And this is very typical that can happen when you are doing a prolonged fast like that. Especially doing 40 days of water fasting, you get to a point where your body kind of forgets how to eat. And the digestive system really starts really not producing a lot of the digestive, what I call just kind of the digestive enzymes or juices to be able to process a lot of these different foods. So what I decided to do is run some certain tests to kind of see where his body state was at, see how well he was absorbing and utilizing different nutrients. And one thing that I do like to test is to test for nitrates and ammonium levels to kind of see how well his macronutrients breakdown was, like vegetables and proteins, carbs, and so forth. And they were very sky high. What I would see is that his levels were very high on the nitrates and ammoniums. And this has to kind of go back with how well you're breaking down your macronutrients in your digestive tract, because your pancreas produces particular digestive enzymes. Ones for carbs, proteins, and also fats. They all have particular digestive enzymes to bind to break it down so that you can process it throughout the body and utilize it. But when you go on a prolonged fast like this person was for 40 days, it gets a little inactive. It doesn't perform as well, and so it does need initial help. So anybody that is suffering from something like this, who's done a prolonged fast, even a 7-day fast, or even 3-day fast, it is good to take a pancreatic enzyme. Now I'll leave some links below that you can check out. I think it's like a 5% off on the different kind of pancreatic enzymes and other supplements to help with digestion when you're coming off of a fast. So I'll make sure to leave that link down below. But as he was taking this, as well as other things that we wanted to test for, is his electrolytes. So his electrolytes were very low, what I call electrolyte insufficient. I've talked about this in my other videos as well. And of course, you need to build that back up. And because he was very fatigued, that was another symptom he was experiencing. He was experiencing extreme fatigue. So we had to bring back his electrolytes, and they'll implementing things such as magnesium, Himalayan salt, potassium, things like that, to bring up his electrolytes as he was kind of bringing foods back into his system and processing it. Another thing that I do like to check is also the acidity level of the stomach, and sure enough, he was running more alkaline, as his pH levels in his stomach, acidity, were very alkaline. And with the problem with that, of course, our pancreas again produces hydrochloric acid for our stomach to produce that acid to break down the foods. But during a prolonged fast, it's going to be again insufficient. It's going to typically run more alkaline, and it's going to be harder to break down the foods. So what I usually recommend is taking something like HCl. It's something you take over a counter, a supplement. Again, I'll leave another link in the description below of one I usually do recommend for people to take that can help break down your food, especially coming off of a prolonged fast. Or for anybody that really has digestive issues, sometimes even acid reflux. People tend to think that with acid reflux that there's an issue with having too much stomach acid. Well, it could also be the opposite. You could also not have enough stomach acid, and it could be really alkaline, so when you're consuming food, it's not breaking it very well, and it starts to get that acid reflux coming back up. So I would say I see this more of the case versus having more acidity in the stomach. That's the thing to consider when you're starting to take these particular supplements when it comes to digestive issues. But along with that, so I started taking some, it was a betaine, which is another kind of enzyme that helps with inflammation. So a combination of betaine and HCl, along with also different pancreatic enzyme. Another great thing is also to help stimulate a lot of different digestive enzymes, and also supporting the liver when you're coming off of a prolonged fast, is taking bitter. So bitter herbs such as dandelion root is also really good, or golden seal. Those things are really great to start taking. It's really bitter, but it's good to take before your meals to help kind of stimulate the digestive system to get it kind of active again when it's been asleep for this long. But just within about a week or two, he was able to not have any abdominal issues. His discomfort and bloating was gone. He was able to have more consistent bowel movements, along with his energy. His energy levels did, peak back up because of increasing electrolytes, and also helping support some of the things hormonally, such as adrenals, and also things that were imbalanced with the liver. So bringing those kind of back all into balance, his energy levels were up, and also his digestive complaints really dissipated. But these are just things you have to consider when you are coming off a prolonged fast, is that your digestive system hasn't been activated for however many days that you're planning on fasting. So sometimes it's good to take some supplement. We call it supplements for a reason. It's supplementing for something that we're not getting in our diet. But when we have been this long without consuming, we do need a little help for a little bit, for at least a good, month or so, depending on how long you've done your fast, to be able to get things back on track with your digestive system. So let me know what you guys think. Do you guys deal with some digestive complaints? Go ahead and leave that in the comment section below. And if you guys like this type of video style where I kind of share with patients that come and see me, I'm trying to keep this as HIPAA as possible. I'm not sharing any names, just kind of give some experiences that I have with patients coming in and treating them. If you guys are interested in that, give me a big thumbs up and share that in the comment section below. And if you're new to this channel, go ahead and hit that subscribe button right here, so that way you can not miss out on any other future videos. I'll also leave some other playlists of fasting videos that you can check out. And until next time, this is Dr. LeGrand signing out. Thanks. Bye.